Learning to walk is one of the most important achievements in a baby's life. We all pass through that phase of life, and it's a big step towards the full human life. At the same time, to work or working is an important achievement that gives us this sense of fulfillment too, of having a fully human life. Okay, but bringing these two important milestones together is key, and they must forever remain with us. At no time will we be done with either walking or walking. All right, but how we do it is very important. We can afford to do it like the picture on my right hand or on the left hand. To underscore the importance of working, I want to elaborate that with this statistic that is showing from the UK statistics. The life expectancy here is in the region of 79.5. If someone should live 79.5 years, out of the total year, 26.5 will be spent sleeping. And that statistic will be bigger among people that really sleep more, which is expected. But I'm going to the next to sleeping in proportion is the number of years spent working. And that will take out of that 79.5, that will be 10.7 years of our lives will be spent working. If you look at the statistics here, we will find out that it will take about 4 years of our lives doing domestic chores, about 2.25 years of our lives going to movies. But this statistics is really about the United Kingdom. Let's see another one that is more global. It says that on the average, about 40 hours per week is given to work. And this will total to about 900 hours in a lifetime given to work. And that will amount to about 25 to 30 years of our total life given to work. And that constitutes like 30% of our human life that we have given to work. So why should we give this much unto work? Firstly, I want to say that to work is a commandment. God says to work. I've commanded you to work. So if any man will not work, let him not eat. In the words of Timothy Keller, he says, we do not merely need the money from work to survive, but we need work itself to survive. So we need work itself beyond what we get from work to survive and to live full human lives beyond money. So in essence, we work to survive. We work also to succeed, because if I can talk about succeeding, I must survive first. So to survive and succeed are the blessings attached to work. But with that blessing comes the burden. So the burden that is associated with working or to work is of interest tonight. And talking about the burden of work is very huge, which in one webinar we cannot look at in total. But I will narrow the scope to the health-related burdens of work. Even as a that is still very big, but I will bring it down to the musculoskeletal consequences, the work-related musculoskeletal disorders associated with work. So when we say work-related musculoskeletal disorders associated with work, it is to say the burdens or what our muscles, our ligament and tendons as a consequence of work, or how our electrical wiring, which is nerve, how they react to work, whether when we do it to excess or when we do it repetitively, how we respond, even how our blood vessels and circulation will respond to work. When work begins to take a toll on us, we begin to feel it as pain or discomfort in our system. At times we begin to feel certain numbness, like certain part of the body that should be very sensitive are no longer sensitive. We begin to feel stiff in the joints, or there are some swellings. In some instances where the wiring is affected, we begin to feel paralysis. In very bad case scenarios, it may even be death coming as a result of work. But we must work. Not to work is not an excuse. We must really work and work hard at work, because to fail to work hard is to sign up for hard labor, really. But let's look at the different parts of the bodies that feel the heat of the burden of the work that we do. In this order, most literature agrees that the back is mostly affected, though there are inconsistencies in literature, but most literature will say our back are the worst hit by the consequence of the work that we do. Our necks too, because most jobs that we do involves posturing of the neck in forward position. Almost everything we do will bring us into bending our necks forward. Our shoulders get to feel the pain of the works that we do, because we move them, we lift them, we use our hand to work, our arms, our elbows. In fact, all the joints of our body will feel the pain or the consequence that is coming from work. But we really must work to survive. We have no excuse not to do it, but we can do this work in a healthy manner. When we don't, we will be getting all these big diagnoses from doctors. They tell you you have carpal tunnel syndrome, you have tendinitis, fibromyalgia, and so on. You know, these names are so big, and when we hear them, they can really cause a lot of psychological, psychosocial consequences again with us. But we really can avoid or limit these work-related musculoskeletal conditions from affecting us. But to get to reduce this from happening, we need to be aware of the risk factors for having work-related musculoskeletal disorders. Now, I will start with how we position or posture ourselves to work. So the work positions and postures. When the positions and postures are not right, like what you can see on the screen, they put a strain on our body. They put a strain on our muscles, on our ligaments, on our tendon. Our muscles, ligament, and tendon have a force that is keeping them in shape. And that force is referred to as the inherent stress that they have. But when the external factor that we call strain overcomes the stress that are within our normal tissues, they will snap like elastic. And when they snap, at times they don't return back. Like when you overstretch an elastic, it doesn't go back to its form. Then it becomes the nature. So when we adopt very faulty postures, it puts undue strain on our muscles, ligament, and tendons. And in that instance, we are prone to developing work-related musculoskeletal disorders. But that is for faulty postures. But still, let's not get too happy to say, oh, in my own work, I do not deal in faulty postures. Even when the posture be right and is taken or done for too long, it becomes a risk factor for developing work-related musculoskeletal conditions. We also can develop that when we get into putting our bodies through excessive force, like lifting heavy objects. Most men want to show macho by saying, I can do it, I can lift it, I can pull it. When we do such thing the first time, there may be nothing, but we're breaking our system gradually. But when we continue to do this repeatedly, we are already risking having work-related musculoskeletal conditions. But many times we don't carry only or lift heavy objects. How about people? The moms in the house, you still want to carry the 2-year-old. The 2-year-old is no longer a child, it's no longer a baby. When you lift any load beyond 10 kg or a load that is more than 10% of your body weight repeatedly, it predisposes to musculoskeletal disorders. All right. Or when we push or pull heavy loads, maybe you're looking for your pounds, it has rolled under the bed, then you are carrying everything, you are lifting the bed, lifting the sofa to look for that. Why not seek help? Why do it alone? Or look for a better way of achieving the same thing. We also get exposed to musculoskeletal disorders when we perform similar tasks repetitively, or we work like the tailors or the people in garment industry. Before a good cloth is done, it requires time. You would have to stay at it to finish, especially during festive period or season when you're working at delivering. So many times when we want to deliver, the deadline is there. Even though the work does not involve lifting something heavy, but we stay at performing that job that keeps us in one posture for too long, then we are at the risk of developing work-related musculoskeletal conditions. Working in an awkward posture or same posture for long period of time, like the people who are into automobile repairs that stay under the car to fix the car, or people whose work involve kneeling or squatting, or work that involve throwing things. You work at the airport, you throw bags where the torso is torn and there's a lot of lifting involved. So that also can predispose us to developing work-related musculoskeletal conditions. How about the plumbers or people whose job require that they press certain part of their bodies against hard or sharp edges, like using the hammer or screwdriver for a long period of time. This and other factors like cold temperature or using things like the vibrator to drill, or a combination of all, really expose us to developing work-related musculoskeletal disorder. Now the question is, what do we do? How do we work healthy? To work healthy will then require that we use proper workstations. In many developed organizations, they have good workstations for their staff because of the consequences or the claims that may come from developing work-related musculoskeletal disorders that can be traced to work, so they are workstations. But in our homes or in small and medium scale business where we really cannot afford all the customized workstations, there are things to do, like using platform to adjust us to to tables, or we have tables that are adjustable to the kind of work we do. Also, to work healthy, we need to use proper work practice, know about manual handling, we need to learn about lifting, and we also need to use appropriate PPE. Our Caucasian counterparts do not play with the use of PPE, but people in the Black, Asian, and minorities here in the UK, a lot of people are involved in tedious jobs, and many times we don't get to use these things. But I say these things are proper, they are good for us, because in the long run, it will save us from developing work-related musculoskeletal disorders. Or we also do not need to engage in awkward postures for more than 2 hours. Any posture that is faulty, that is taken for more than 2 hours, is considered too long. Okay, and we do not need to engage in kneeling for more than 2 hours. The kneeling posture, we go through in our routine a lot of postures, but the thing is, do not engage in one posture for too long. You must do your bit to make sure you change posture. How about trying to carry or do pincer grip, or use what we refer to as awkward grips? Any awkward grip that we do for more than 2 hours is a potential trigger for work-related musculoskeletal conditions. Then we should avoid localized pressure on body parts for more than 2 hours, or avoid using our hands and or knees as armor for more than 10 times in 1 hour. Our colleagues that are into care work or that work in nursing home find themselves doing a lot of lifting, helping patients to move from wheelchair to bed and all of that. In one study that we did in Nigeria, we found a high prevalence of work-related musculoskeletal disorders among nurses. In another study, we found a high prevalence of work-related musculoskeletal conditions among physiotherapists, in fact, among many healthcare workers, because really they are prone to developing all these things. But of special mention tonight is sitting. Before we get happy to say maybe our own kind of white-collar job does not involve awkward posturing or using vibrator or vibrating machine that can rebound to our body and cause us work-related musculoskeletal disorders. Hardly is there any job that we do that does not involve sitting. So I have decided to do this presentation tonight standing, because I have had to sit for a long time to make my slide ready. So I decided to stand up to counter the sitting time that I have had. This is just one thing that we really must give attention to. Most works that we do now involve a lot of sitting. On the average, we sit between 8 to 12 hours daily. And that would amount to like 2,000 hours of sitting yearly. And in the course of our work life, we would have sat for 80,000 hours. And this is huge. This is a lot. Why is it a lot? is because it has consequences. When we sit often, we are at the risk of developing overweight and obesity, which in itself is a precursor for developing diabetes, cardiovascular disorders, and other musculoskeletal conditions. And in addition, this will also cause work-related issues that will get us out of work, that is work absenteeism, or if we do not want to play work absenteeism, we be present at work but not doing the work, which we call presenteeism. You are there but not there. So, and absenteeism and presenteeism are known to decrease productivity in the workplace. So recently, it is said that sitting is the new smoking, because all the things that smoking is known to cause, sitting will also cause it. So if sitting is the new smoking, why not let us sit responsibly, like it is said about smoking? Let's reduce sitting. Let's break sitting time. Then it is worse if the work that we do involves sitting and then we smoke too. Then it is now double smoking. You smoke with the mouth and you smoke sitting. All right, so beware of sitting is the new smoking. So what do we do about sitting? We should use sit to stand workstation instead of having the sitting desk most of the time. We should encourage ourselves to do standing and walking meetings instead of the usual sit down kind of meetings. When we do standing or walking meetings, we will be very conscious of time. Many times when we sit, we just forget about time and we carry on. Because I'm standing right now, I'm talking very fast so that I can finish my presentation on time. So if I be seated, maybe I feel more comfortable. We should encourage face-to-face interactions instead of making the calls and sending the emails. So instead of making the calls, you're still within the premises, why not make the trip instead of the call? Then we should encourage short breaks and micro pausing. By micro pausing, we mean whatever you do, even using the right posture at work, can you just stand and break it? Okay, we can set break alarms that will remind us that it's time to stand. You have sat for too long. Now, people ask, what is the best chair for me to use at work? We have conflicting recommendations. Some will say when you sit on a chair that allows you to sit in angularity within the chair, it's your best chair. Some will say you use a chair that permits you to recline. Even the best of chairs can still predispose to work-related musculoskeletal conditions if you don't limit the amount of sitting time that is done in those chairs. So even when you are seated on those chairs, we say it is good you move from decline sitting to recline sitting to upright sitting. By every means, make sure you're changing your posture. Then it is important to say that if we must walk healthy, we need to obey the law of rest. The law of rest. Even God rested after working 6 days. So, and the ratio of work to rest from Genesis was 6:1. God worked for 6 days, and on the 7th day, he rested. So we cannot afford to work 7 days because we're looking for pounds, because we're looking for dollars. You work all through the week. On Sunday, you're still working. So the law of rest is being violated. God worked for 6 days and rested on the seventh day. So if we must walk healthy, we had to do it like God. But what God did not do was to work for 1 day and rest for 6 days. So the ratio is very clear. Having talked about work, then let's look at work. How do we work healthy? How do we work healthy? I start with why working? Why do we need to work? We need to work because it's simple to do so. You need no special equipment to work. To work is doable and it's just easy to work. All right. Why do we need to work? It has a lot of benefits for health. It helps to lower blood pressure. It helps to reduce blood sugar. It improves balance, coordination, and spinal health. Then it helps to lower what we call the bad cholesterol. It makes us fit. It reduces the chances of developing osteoporosis. It helps to improve blood flow. It helps to boost our mood. It helps or enhances our psychosocial health and mental health. And it is said that it reduces certain cancer. Just walking can do all of this. So how do we work? I just say walk like a child, walk like the baby. They are just free. They don't do it sluggishly. When they learn how to walk, having attained it the first time, they want to show it every time. So we say walk briskly, hold your head high, swim the arms, keep the shoulders straight, tighten the stomach muscles, and then use long strides. For every opportunity we get, we should just keep walking. Use the stairs, not the elevator. My mentor here in Manchester will use, for every opportunity he gets, it will work. It will say, use the stairs, don't use the elevator. While you're waiting to get something done, I see him moving around because there are certain steps he must achieve on daily basis. So use the steps, use the stairs, reduce the use of elevator. This we need to do before work becomes work. We need to work now before work becomes work indeed. So how do we work healthy? We need to work to work. Even when you drive to work, can you park at a place that will give you opportunity to get some steps so that you will walk to the office and then also walk back to where your car is? Then we need to learn the culture to work at work. The break time shouldn't be all for coffee and for cheese only or discussion with staff. We can do some 20-30 minutes, then use the remaining 30 minutes between 12 and 1 break that we have to do some walking before we get back to work. Then we need to do walk for work. This is done especially in African setting before camera with a lot of jamboree, where the universities, the hospitals would do work for health and everybody is out there working. This is very good and commendable. But allow me to state that before we will call out people to come and do a 1 hour work because our workplace is doing whatever name we call it, we need to let the people start to practice to work at work before we call them out to work for work. Somebody who really has not been doing the first two, who has not built resilience, is being asked to come and do 1 hour because we are doing a program. And these people have not gone through a lot of health check to know their status. We are not far from getting casualties among people during such work for work. But in the UK context, where a lot of people will know their health status, we know their health condition, their heart condition, and all of that, this will be an opportunity to add steps. The more steps we add to us, the more we add to our health. If we fail to work, or work at work, or work for work, we will not be too far away from walking away from work, because at such time a disease condition may have set in that will now make us not to be able to do that work proper. In conclusion, this is Hippocrates. He says that walking is man's best medicine. So regular and longer work not only increases your chance of living longer, but it also helps you get more energy. It helps you to stay healthy and positive. Then also, I saw that God also walked. Genesis 3 and verse 8 says, and they heard the voice of the Lord God in the garden walking in the cool of the day. God came to man walking in the garden, and God did his walking in the cool of the day. The cool of the day could mean evening period or early in the morning, whatever it is. Walking should be done when the environment is best for it, the cool of the day, morning time, evening time, or even in the afternoon. If you can control that environment to make it cool, like in the gym, it becomes the cool of the day. So why should we walk? To avoid walking away from work. Hippocrates said so, and God did so. Thank you, everyone.
Isn't that amazing? Thank you so much, Doctor. I have learned so much today, and I'm quite sure, yeah, a lot of our colleagues and members and fans who are here have learned so much today. And one of the things you said that I wrote this down here. Just give me a second. That's a new one to me, and I'm quite sure it's also a new one to most of us here. Sitting is the new standing. You said sitting is the new standing, and that was something quite amazing. And you mentioned something also about smoking. Am I right? Smoking and sitting.
Okay, are you asking me as a question?
Yeah, I'm just going over what you mentioned,
okay,
and I'm just
you.
saying how important it is. And you mentioned about what to do about sitting, using as a sit stand workstation, conducting standing or walking meetings, encouraging face-to-face interaction instead of emails or calls, short break versus micro pausing, and setting alarms, break alarms. That's so interesting. Thank you so much. Is there any questions? And anyone would like to ask any questions to the doctor? Please go ahead. Got a question here. There are guidelines for physical activity and sedentary behavior among our counterparts in the developed world. How do we achieve it in the developing countries?
All right, thank you, Dr. Idowu, for that question. Unfortunately, most of the guidelines for physical activity are developed in the Western nations, and they are being exported to low and middle income countries. there is no problem with globalization of guidelines or concepts, but the problem actually is the suitability of such guidelines. Now, there's a gross difference between the environment here and the environment in sub-Saharan Africa. The environment here requires that nothing less than 30 minutes of walking is done on daily basis. In fact, nobody will tell you to do the work when the cold is catching you very well. And you know that if you do the work, you will get warm a bit and you'll be better off than staying. But the guideline is developed around this context. But back in sub-Saharan Africa, there's a lot of heat. So why should you put someone under that heat? God worked in the cool of the day. These people do not have a lot of cool of the day to themselves, and you are asking them to do 30 minutes per day under the hot sun. I think really is injurious to health. So it is time we pick our own health and begin to do research that is sensitive to our own environment than extrapolating and adopting what is done here that really may not work best in our context. We do not know whether in our context we need less than that or we need more than that. But I am not sure that taking what is said here is best for us. But again, we are better with that than nothing. It's the half bread that is better than nothing. Yeah.
Thank you so much. Thank you, Opiyemi, for that question. Now there's something here. What advice will you give to a physiotherapist often doing a lot of repetitive movement and manual skills while discharging his professional duties? Thank you. And that's from Olagoki. I hope I got that right. Thank you.
All right. This is what I would say, Olagoke. I want to show a slide. I wouldn't know if you can see this. Can you see this slide? This is what the employer can do. You should request for mechanization of your work. You should request for job rotations. You should request for teamwork and job enlargement. You need not do all the manual handling using non-appropriate workstations, and you get yourself involved in a lot of repetitive motions and not come down with work-related musculoskeletal disorders. Then we should be asking for mechanization of our work. We need a lot of teamwork. Instead of running on call duties, we should be asking for shifts. We cannot work 24 hours. It is against human health to work for 24 hours. So we should work in shifts, do job rotations, do teamwork, and job enlargement. Thank you.
Okay, I've got 2 questions passed to me from the audience. Can I take them one by one, please?
Thank you, sir.
The first one is, what is the difference between walking and using the treadmill, or which one is better than the other?
Okay. I will not be able to say one is better than the other. Both affords us the opportunity to work. To work, we need a very good environment, a good neighborhood, a safe place to work. If we cannot get that and we still can work and the cool of the day is within our house, by every means, we must keep working. There are a lot of advantages associated with walking outdoors, the fresh breeze and air. Then you see people, it helps psychosocially. But by every means, too, using the treadmill helps to achieve the health benefits of walking. So I wouldn't play that down. So I'm unable to say one is better than the other. Both are providing us the opportunity to walk.
Okay, thank you, Doctor.
Yes,
I'm
sir.
sure the person that asked the question is listening. The second one is that he said, I am 75 years old. He said he watched the risk factors and he belongs to one of them,
Okay.
but he didn't have the opportunity of workshops like this before now. So he's already suffering from backache, shoulder ache, and a lot of it. That what can you suggest for her, for him? Sorry.
All right. If in the UK you have access to care, so you should see your GP or your physiotherapist. That said, there are other care that we can give to ourselves that are still acceptable. If the pain is coming and it's within the joint, the HIIT therapy is advocated by NHS for home use. So I will recommend that you visit the NHS site. There are a lot of recommendations for home management of musculoskeletal conditions. When you don't get the home management benefits, please call the GP. The GP will refer you to your physiotherapist.
Thank you, Doctor.
Thank you, sir.
I think Dr. Reverend Dolly has got her hands up.
Yes,
Reverend.
thank you very much, Olga. And thanks so much, Dr. Mbada. Your
Thank you, ma'am.
presentation is always top notch.
Thank
And
you,
it's one of those that nobody wants to miss.
Thank
I
you.
remember your, just as a way of compliment, your first session with us about the last straw. I kept saying it every time when I'm going to bed and I'm propping pillow between my thigh and everything and my back. I'm like, oh no, I don't want to wait for the last straw that breaks the camel's back. So God bless your knowledge, sir.
Thank you, ma'am.
Yeah. I was just going to talk about the work-related health problems that you mentioned, which I feel so many of us, including myself, are guilty of now. Looking at it, things like you said, pain, discomfort, numbness, loss of motion. Especially my concern is about inflammation. I have a friend that's at the moment, the level of inflammation, and she used to be a very workaholic, and the inflammation is so bad and swelling around the whole body. So this is giving me insight into this now, that this is work related, because we're like, what could be causing this inflammation? And they talk about inflammation marker, and it keeps rising up. And then you went further to talk about the musculoskeletal, disorders. And it's so appalling when you said 80,000 hours in the course of our work life. We used, sitting down, sedentary position. So what can be done for somebody like, I think it's kind of similar to the question that came ahead of mine, though I'd already raised my hands up, about what can we do to assist, especially somebody that's got like inflammation marker and rheumatism or whatever. If I take that into what Reverend Tony, the question they posed to Reverend Tony about the treadmill and the walking, I know that sometimes they say that when you have all these related issues, I think the best one is not to put further pressure on the joints, that it's safer to go. So I just wanted to have that to go on the wall. But if I want to just go by my own question and face my own issues, is what can be done to such person? Should they take time off work? Because I realize it's too much, maybe it's too much of work that's really put them in that situation. So should somebody like in that situation just take time off work to attend to their health and get back, or still trying to manage and tag along?
Yeah, thank you, ma. Usually if they see their physiotherapist, they will say when the joints are swollen and painful, they want to remove any form of trigger. Now, walking may be a trigger that will be causing a lot of re-injury. The first thing is to manage the swelling or inflammation and pain. When swelling, inflammation, and pain is reduced, then the patient should be reintegrated gradually back into walking. But to get into walking well, the patient will need to go through conditioning process. Now, reconditioning here we mean strengthening, because many times whenever pain comes and is affecting the joint, it is not only the pain that we will manage. The pain in itself will cause the joints and the muscles around to start shutting down. So that we call muscular inhibition, when the muscles that hold the joint and enables movement are shutting down in their millions, the muscle cells. So when they shut down that way and the pain is then lifted, strength is not restored automatically. We don't expect that when pain is gone, strength is back. What we want is when pain is gone, you go back to strengthening. And there are easier ways of strengthening today. In the UK, there are a lot of TheraBands that you can be given. In fact, they don't use sandbag anymore. TheraBands are given to patients. You can tie it on your chair and start to strengthen the cords. So when the cords are strengthened and they are strong, then they are able to carry you to walk. If the cords are not strong, then walking is a lot of work. It becomes very difficult. Yeah. But the first thing first, treat the pain, treat inflammation. When pain is abated, strengthen the muscles, gradually reintegrate patient back into active life, which involves walking. Yes.
Thank you very much, sir. That's very
Thank you so much. Thank you, Reverend Dolly. There was one more question I wanted to ask the doctor. In regards to data and statistics, is there anything that shows with regards to the effect on BME patients more than their white counterpart in regards to musculoskeletal issues or
Yeah,
conditions?
thank you. Right now, I do not have any data that separates the Caucasians from BME community, but we have data that separates people in high income countries from people in low and middle income countries. But what we have is that both sides have their own fair share of prevalence of musculoskeletal disorders. And that is to say that a musculoskeletal disorder is not a respecter of race, it's not a respecter of anybody. Anyone that violates its rules or doesn't go according to the rules of safe walking will be hit by work-related musculoskeletal condition. But it is just common sense for us to say that people in the BME community who are really exposed to a lot of difficult working conditions, and they may not have the PPE. They are the people who will do a lot of manual handling. They are the people who will stay around a job for too long. And for that reason, they may be exposed to work-related musculoskeletal conditions more. But the statistics that I have really do not separate them from others.
Thank you so much. Is
Thank
there any more questions? Then I'll hand over to the Reverend Dahl.
I just want to chip this in. The last question to Dr.
Mhm.
Mbada. Could we say this musculoskeletal, apart from the pressure from work, could we say some of it could be genetic? Because I'm just trying to look at a family that has this structure, and it looks like the children, one or two of them have picked it up. Could it be genetic as well?
I read this funny cartoon. Somebody went to see the doctor, and the person was complaining about overweight and obesity. And he has this to say to the doctor. He says, the problem is this thing runs in our family. Then the doctor replied and said, the problem is nobody runs in your family.
That's a good one.
So many times, work-related musculoskeletal conditions are work-related, even though there is a thin line between really having it so work-related and we detach other causes from it. But essentially, most of these things are work-related. We have the ones that are not work-related. We have some that have hereditary background. They are the autoimmune types, like rheumatoid arthritis. So rheumatoid arthritis is not in this class. It affects the joints. It affects more than one joint in its presentation. So when it's showing that way, the weight-bearing joints are affected, and also the small joints of the hand or shoulders are affected. And it's worse in the morning. It gives way as the day goes by. Then we already know we are dealing with, which is different from the work-related ones that we are talking about.
Yeah, my name is Omoni. Thank you very much, sir, for
Thank
the
you.
beautiful presentation.
Thank you, sir.
And the question I want to ask is there a specific recommendation or guide on how to walk properly?
Okay. I will flash for you the slide. In my presentation, I say to walk, just walk like a child.
Like a child, yeah.
A child is happy. A child will walk briskly. A child will hold the head high, will swing the arms, keep the shoulders straight, tighten up the stomach, and use long strides. When the walk is sluggish and sloppy, it becomes stressful. It doesn't achieve its effect. But again, it is important we understand that the health benefits of walking are better gained through a conditioning of the mind to achieve it. Sometimes we walk and we consider it as stress. Oh, I want to go from this point to that point, it's too far. Oh, I will just stress myself. For doing that, somehow we don't gain the health benefit. But once I can cover the same distance with a mind made up that, oh, I will walk it and it will add to my steps, then I will gain the health benefit. So that tells us that there's a psychosocial overlap on walking to derive the benefit in it. If you consider it as stress, then you are stressed and you don't get it. But if you see it as the opportunity to add to your steps, then you get the benefit. So how that works, we need real science to help us explain. Yeah. Thank you.
Dr. Mbada, we love you.
Thank
we
you, ma'am.
appreciate you. Thank
Thank
you,
you.
everyone. Have a
Thank
blessed
you.
night and see you next month.